In Nigeria, dysmenorrhea is a prevalent condition among women of reproductive age. According to a study published in the Journal of Pain Research, the prevalence of dysmenorrhea among female undergraduates in Nigeria was found to be 72.8%. Another study published in the African Health Sciences Journal found that the prevalence of dysmenorrhea among female secondary school students in Nigeria was 84.2%. Dysmenorrhea is the medical term for menstrual pain or painful menstruation. It is a common menstrual disorder that affects many women of reproductive age. Some pain, cramping, and discomfort during menstrual period is normal, but excessive pain that can cause you to miss your school, work, or cause you to stay at home is not normal. Imagine someone that couldn't write a final paper because of menstrual cramps. This is called dysmenorrhea. Dysmenorrhea can be divided into two. First, primary dysmenorrhea, and second, secondary dysmenorrhea. Pain or menstrual cramps before and during menstruation with no symptoms of an underlying gynecology disorder is called primary dysmenorrhea. It is a normal process of menstruating and it is the most common. For many women, the pain reduces as they age or particularly after a pregnancy. Causes of primary dysmenorrhea. The exact cause of primary dysmenorrhea is not known, but it is believed to be related to the increased production of prostaglandin in the uterus, which cause the uterus to contract. Factors that may contribute to primary dysmenorrhea. The first factors include hormonal changes. During menstruation, there are significant changes in the levels of hormones such as estrogen and progesterone. These hormonal changes can cause the uterus to contract more strongly, leading to pain. Lifestyle factors. Poor diet, lack of exercise, stress, and smoking may contribute to the development of primary dysmenorrhea. Structural abnormalities. Some women may have structural abnormalities in the uterus, such as a retracted uterus, which may lead to painful menstrual cramps. Prevention of primary dysmenorrhea. While it may not be possible to prevent primary dysmenorrhea entirely, there are some steps that individuals can take to reduce their risk of experiencing menstrual pain. These include exercise. Regular physical activity can help reduce the severity of primary dysmenorrhea. Exercise such as dancing, stretching, walking can help to alleviate menstrual pain. The second, dietary changes. Eating a healthy, balanced diet that is rich in fruits, vegetables, and whole grains can help reduce inflammation in the body, which may help alleviate menstrual pain. Pain management. Over-the-counter pain relievers such as ibuprofen can be taken at the first sign of menstrual pain to help reduce the severity. Note: this may not be good for someone that has ulcer. The next one is heat therapy. Applying a heat pack or taking a warm bath can help relax the muscles in the abdomen and reduce menstrual pain. Another one, relaxation techniques. Stress can exacerbate menstrual pain, so practicing relaxation techniques such as yoga or meditation can help reduce stress and alleviate menstrual pain. Hormonal contraception. Hormonal contraception such as birth control pills, patches, or intrauterine devices can help reduce menstrual pain in some individuals. It is important to note that not all of these strategies may work for everyone, and individuals with severe menstrual pain should speak with their healthcare provider for an evaluation and personalized treatment plan. Now, on to secondary dysmenorrhea. Secondary dysmenorrhea is a medical condition that causes painful menstrual cramps due to an underlying medical condition. unlike primary dysmenorrhea, which occurs without any underlying medical cause. Secondary dysmenorrhea is usually caused by an underlying condition in the reproductive organs or other parts of the body. Some of the underlying medical conditions that can cause secondary dysmenorrhea include endometriosis. This is a condition where the tissue that normally lies the inside of the uterus grows outside of it, leading to painful menstruation. Then, adenomyosis. This is a condition where the tissue that lies the uterus grows into the muscle of the uterus, leading to painful periods. Another one, uterine fibroids. These are non-cancerous growths in the uterus that can cause painful period. Ovarian cysts. These are fluid-filled sacs that form on the ovaries and can cause pain during menstruation. Cervical stenosis. This is a narrowing of the cervix that can cause pain and cramping during menstruation. Other medical conditions that can cause secondary dysmenorrhea include irritable bowel syndrome. Some treatment options for secondary dysmenorrhea. Medication. Pain relievers such as non-steroidal anti-inflammatory drugs can be effective in reducing menstrual pain. In some cases, stronger prescription pain medications can be necessary. Hormonal therapy. Hormonal therapy such as birth control pills, patches, or intrauterine devices can be effective in reducing menstrual pain in some individuals with secondary dysmenorrhea. Surgery. In cases where the underlying condition causes secondary dysmenorrhea is severe, surgery may be necessary. For example, surgery can be necessary to remove uterine fibroid or endometriosis lesion. Antibiotics. If the underlying condition of secondary dysmenorrhea is an infection, antibiotics may be necessary to treat the infection. Lifestyle changes. Making lifestyle changes such as exercising regularly, eating a healthy diet, and practicing stress-reducing techniques can help to alleviate menstrual pain. How can secondary dysmenorrhea be prevented? The prevention of secondary dysmenorrhea depends on the underlying cause of the condition. However, there are some general steps that women can take to reduce the risk of developing secondary dysmenorrhea. Practice good hygiene. Proper hygiene can help prevent infections of the female reproductive organs such as pelvic inflammatory disease. Manage stress. Stress can increase the production of prostaglandin, which can lead to painful menstrual cramps. Practicing stress reduction techniques such as medication, yoga, or exercise can help manage stress levels. Exercise regularly. Regular exercise can help regulate hormonal levels and reduce menstrual cramps. Maintain a healthy diet. Eating a healthy, balanced diet with plenty of fruits, vegetables, and whole grains can help reduce inflammation and regulate hormones. Quit smoking. Smoking can increase the risk of menstrual pain and other reproductive health problems. Treat underlying medical conditions. Treating underlying medical conditions such as endometriosis, fibroids, or ovarian cysts can help reduce menstrual pain. Use birth control. Hormonal birth control can help regulate hormonal levels and reduce menstrual cramps. Lastly, how to differentiate between primary and secondary dysmenorrhea. Primary dysmenorrhea is menstrual pain that occurs in the absence of an underlying medical condition. It is typically caused by the release of prostaglandin, hormone-like substances that are produced by the lining of the uterus during menstruation. The pain associated with primary dysmenorrhea usually starts a few days before menstruation and can last for a few days after menstruation begins. The pain is typically crampy in nature and is usually located in the lower abdomen or back. Secondary dysmenorrhea, on the other hand, is menstrual pain that is caused by an underlying medical condition. These conditions may include endometriosis, uterine fibroids, adenomyosis, pelvic inflammatory disease, ovarian cyst, or cervical stenosis. Unlike primary dysmenorrhea, The pain associated with secondary dysmenorrhea may not be limited to the menstrual period and may occur at other times during the menstrual cycle or even throughout the month. The pain may also be more severe than that associated with primary dysmenorrhea and may be accompanied by other symptoms such as heavy bleeding, irregular periods, or pain during intercourse. To differentiate between primary and secondary dysmenorrhea, a medical evaluation by a healthcare provider is necessary. This evaluation may include a medical history, physical examination, and possibly imaging tests or laboratory tests.